going to talk about the differences between a doula and a midwife.
Hi, I'm Brittany with Beautifully Connected. I'm a birth doula, massage therapist, and I practice herbals with the Wise Woman method. Welcome to my channel.
One of the most common questions that I field through my agency is, so you're a doula, that's kind of like a midwife, right? And the answer is kind of yes and kind of no. We are not medical people. So doulas are non-medical labor companions. They're more like consultants or coaches or just like a friend or a mom, whereas your midwife actually performs medical tasks. So midwives are the ones who see you throughout pregnancy. They draw up lab work, they can read your blood tests, they do growth measurements, and they listen to fetal heart tones, they assess your blood pressure. These are all things that are way out of scope of practice for doulas. Additionally, most midwives have certifications and licenses. Some midwives are even also nurses. So there's a lot of difference between the training between midwives and doulas. Doulas technically don't need to have a training. So a lot of us are just people who like birth, and we are people who have read a lot about birth. Many of us have experienced birth. There are certifications and training programs, but technically there is no state body or national body that says you have to be certified to be a doula, whereas midwives have to take an extensive education and training route, and most of the times they have to also take on apprenticeships, which can be years long. So the difference between a doula and a midwife, a doula is like somebody who's fanatic about birth, really enthusiastic, is there to hold your hand, support you, give you all your options, whereas a midwife is actually going to guide you through the medical process of birth. So we're very, very different. Another thing I want to touch on a little bit is that midwives don't do the things that doulas do. So midwives, like I said, they are medical minded, and they are your birth companions, and they are to guard you and your baby, to watch for any problems that might arise, and to help you through the birth process safely. And doulas, yes, we like to watch for safety. We like to give you your options, but we're not guiding you through any medical decisions or processes. So when you have a doula, we are there to help you make the decisions for yourself, to make sure that you're educated and empowered, but we're not actually performing any kind of medical tasks. So the midwives, yes, sometimes that they can perform like some emotional support. A lot of midwives also do a lot of education, which is very different from OB care. So if any of you pregnant ladies are watching and you've had care with an OB, you know that a lot of times with the OB care, it's like really routine. You're in for like 2 or 3 minutes, they see you, hi, goodbye, and then you're out. With midwife care, it's totally different. So a lot of times with the midwives, you'll sit for 30 minutes or an hour throughout your appointments just talking and expressing your fears and getting some education, which is really great, because I think everybody should have midwives if that's possible for them, if they're low risk enough. But midwives cannot be an active emotional and physical support in labor, because they're busy charting and they're busy watching your labor, they're busy listening to heart tones and ascertaining blood pressure, and a lot of times they're communicating with other clients who might be in labor. So it's important to know that you might need some more physiological support or physical support from another support person. So if a midwife is managing a medical emergency that arises at your birth, she's not going to be able to talk to you very efficiently because her mind is going to be very focused on the task at hand, on helping you or helping your baby. So in that case, if there is some sort of emergency that arrives, you would want to have another support companion with you who understands the process of birth, who understands what's going on. So I like to have partners in the room, whether that's your husband or your fiance or your partner. I want that person to be in the room, definitely, and they're going to love you and support you in a way that a doula never could. But I also think it's really good to have another support person, another person who understands birth. Your support person, your husband, your partner, they're not going to understand, most likely, all of the medical jargon or some of the complications that might arise at birth. So I think it's a really good idea to have another calming presence who could help you through the emotional part of birth, and then with the physical support. So a lot of times midwives do like to suggest like different position changes and support mechanisms that you could do, which is very similar, as doulas do this as well. but a lot of times the midwives are too busy with the medical side of birth to actually participate in the physical help with the birth. So a lot of times, especially at home births, doulas will do like cleanup and they'll help get the birth room ready and all of that stuff, but we're also helping you. We are there only for you. We want to make sure that you are safe and that you are happy, and we don't care about what's happening medically because we're not trained to care about what's happening medically. We only care about your emotional well-being, your physiologic well-being. Additionally, people think that if they're having a home birth or a birth center birth or whatever your birth looks like, that if they hire a doula, they're somehow safe from all intervention, which is not particularly true. A lot of midwives still use interventions. So if you are looking for a physiologic birth and an intervention-free birth, it might be good to have another consultant with you or just another birth expert who can help you kind of navigate through different interventions that might happen at home births. Sometimes midwives want to break your water. Sometimes midwives want to use herbals to help speed labor along or to do different things for your pregnancy. Just because things are natural or midwives do them all the time, it doesn't make them 100% safe. I strongly feel that women should know all of the options about every possible intervention in their birth. So whether that is herbals or position changes, or even I've had some midwives say that their clients always give birth in the water because that is what's best for them. And I'm here to say giving birth in the water is not best for every person. I think that women should be comfortable and should be free to make their own decisions. So as a doula, I feel like I really am there to safeguard that. Additionally, a lot of times the midwives are busy with other clients, and because they're only managing the medical side of the birth, a lot of times they don't show up when you are in labor. So when you're into labor, your contractions are ready, you feel like you're coping well, but sometimes maybe you need a little bit of extra help or assistance, or maybe you've done all the coping things that you can do by yourself and with your partner, and now you're feeling like you need extra support. A lot of times your midwife isn't going to come until labor has very far progressed, until you really are not coping well at all and you feel like the baby is coming. So a lot of times doulas, they can fill the gaps of support that we have in our maternity care system. So the doulas are going to be there immediately as soon as you call them. Like you call us, whatever, 2, 3 o'clock in the morning, we're not going to ask you if you're really in labor or ask you if it's a false alarm. We trust you and we know that if you're calling us, you need us for support. A lot of times because the midwives might be at other births or maybe they had just had a birth recently, they want to catch their sleep, understandably, and they don't show up until later in the birthing process. So I also think that that is very important for new mothers to understand. Have you guys have any other questions about the difference between doulas and midwives? And if so, leave them in the comments for me. Thank you guys.
Thanks for watching. Make sure you hit the subscribe button if you like this video. Also, if you have any questions about holistic health, be sure to put those in the comments for me.